The X-Zone radio and TV show is largely an opinion talk show. All opinions, comments, or statements of fact expressed by Rob McConnell's guests are strictly their own and are not to be construed as those of the X-Zone radio and TV show or in any manner endorsed by Rob McConnell, Relmar McConnell Media Company, Talkstar Radio Network, its affiliated stations, or employees.
All Hit Radio.
Welcome to the X Zone, a place where fact is fiction and fiction is reality. Now, here's your host, Rob McConnell.
Being my friend, I said you called Dr. Robert. Day or night, he'll be there anytime at all. Dr. Robert, Dr. Robert, you're a new and better man. He helps you to understand. He does everything he can. Dr. Robert, if you're down, he'll pick you up. Dr. Robert, take a drink from his special cup. Dr. Robert, Dr. Robert.
And welcome back to the X Zone, everyone. My name is Rob McConnell, coming to you live from our studios in Hamilton, Ontario, Canada. 1-877-528-8255 is the magic number to reach us here in our studios. And if you'd like to send an email, xzone@talkstarradio.com. On MSN Messenger, talkstarradio@hotmail.com. And our websites, www.xzoneradio.com and www.xzonetv.com. This hour we are going to be talking about that nasty bug that is going around and biting people and causing them to be rather ill. It's causing a pandemic effect. And we're talking about the H1N1, the Heine flu. My guest this hour is Dr. Len Saputo. He graduated in 1965 from Duke University Medical School. He's a board-certified internal medicine doctor and was in private practice in affiliation with John Muir Medical Center in the San Francisco Bay Area for more than 30 years. After his awakening to the deep flaws in conventional medicine, which culminated in the early 1900s, Dr. Saputo began a quest to develop a new approach to healing known as an integral health medicine, the emergent medical care model that is integrative, holistic, person-centered, and preventative. In order to further this mission, Dr. Saputo founded the Health Medicine Forum in 1994 and was its director until 2008. In 2001, Dr. Saputo co-founded what is now called the Health Medicine Center in Walnut Creek, California, one of the first clinics to bring the new model of integral health medicine into practice. And joining me now is Dr. Saputo. And Doctor, first of all, thank you very much for joining us tonight here on the X Zone. And how is the H1N1 flu overhyped, or is it as dangerous as the media is telling people it is?
Well, Rob, to make it pure and simple, it's a scam.
It's a scam.
Okay? It's a scam. I mean, it's no more than a common cold, and the World Health Organization and the CDC have taken upon themselves to track this thing. And, of course, it is a pandemic. Lots of people are getting it, but hardly anybody's dying from it. It's not like the influenza, the regular influenza that causes in the U.S. every year about 36,000 deaths. There have only been about 1,000 deaths so far. And even the prevalence has been overdone. When you look at what CBS News had to go through to get information from the CDC, it's very awakening. Because basically, CBS was trying to do a study of this and feature it. And for a couple of months, they were trying to get information from the CDC to let them know what the prevalence was. And the CDC wouldn't release the information. They started, what's going on here? I mean, this is a big epidemic. Why don't they just tell us the numbers? And I kind of noticed that after about June or July, a lot of the numbers weren't being talked about much. We were just assuming everybody had the flu. So when CBS went ahead and they looked at the individual records from the states, which is what they had to do, they found that the incidence of swine flu amongst all the colds and flus in the United States was between 3% and 17%. So the epidemic is basically over. and yet they're still promoting that this particular swine flu is something that is to be feared and is all over the place. And when you see that there are only 1,000 deaths compared to the 36,000 that you normally see just with the regular flu, something's wrong. Doesn't make any sense. Why would we go through the trouble of convincing people through scare tactics if they've got to go out and take this vaccine?
All right, you and I have to take a 2-minute commercial break. Please stand by, Doctor. When we come back, I'd like to get your take on why the media, as well as the medical community, is making such a big doo-ha about getting your influenza shots or your H1N1 shots, and so much preventative medicine apparently is going into this. Dr. Saputo is our special guest, and the good doctor and I return on the other side of this commercial break as we continue right here in the X Zone on the Talkstar Radio Network from our studios in Hamilton, Ontario, Canada. Don't go away. We'll be back after this 2-minute break.
Day or night, he'll be there anytime at all. Dr. Robert, Dr. Robert, you're a new and better man. He helps you to understand. He does everything he can. Dr. Robert.
It's a sign of the times that your love for me is getting so much stronger. It's a sign of the times, and I know that I won't have to wait much longer. You've changed a lot somehow from the one I used to know. For when you hold me now, you feel like you never want to let me go. It's a sign of the times that you call me up whenever you feel lonely. It's a sign of the times that you tell your friends that I'm your one and only.
People have been reported waiting in lines in Canada and the United States for up to 9 hours to get the H1N1 flu shot. Now, not everyone is eligible for this flu shot. And, doctor, if this is a scam, who is behind the perpetration of such a scam that is affecting millions of people and causing so much scare in the United States and Canada today because of the H1N1?
Well, that's a really good question. You know, I don't really know. But when you start looking at things, you start to wonder. We've shown that there's not really an epidemic that's going on anymore, that the virus isn't that lethal compared to the regular flu. We know that the vaccine may not work. In fact, even the insert on the package the vaccine comes in says that this doesn't guarantee that the vaccine will work. It will make antibodies against the virus, but whether or not those antibodies are going to do anything to the swine flu is unknown. We haven't tested the virus in terms of the vaccine's killing effect. We know that the government is withholding data from us. It's hard to know what could be a purpose. Why would they want to do something like that? If there's no real value to it and they're still promoting it, you just have to start using your imagination, I guess. And you read all kinds of things. You know, when you look at some of the conspiracy stations that I've listened to, like Alex Jones and some people on George Norrie and other stations, and they make you think. But do I know the answer? No, I wouldn't know. It concerns me a lot that we have martial law, you know, through the Patriot Act of the United States, and that we have President Obama coming out declaring a national emergency, that the swine flu is here. And they're using scare tactics that are brutal. I mean, we've got people from the cutting in lines to try from Goldman Sachs trying to make sure that they get their vaccine first. It's an amazing thing with what if you want to get people to do something, just scare the heck out of them and then tell people there's a shortage. So what could be happening? One thing that crossed my mind as I was reading through Reuters News the other night is that there's this thing there's a chip put out by VeriChip.
Yes.
And the idea of this chip is to be able to track and find out, once it's in a person, whether or not you have a virus that's from a swine flu or a regular flu or it's a cold or maybe other information. And when I put two and two together, I thought, my God, what happens if somehow there's a nanochip in this vaccine? Wouldn't that be something? It'd be a way to track people. Not to say that there wouldn't be medical uses for something like that, because I'm sure there are. But I'm worried about things like that, because if it doesn't make sense, you have to think of something. Mm-hmm. And we're stuck.
You know, I've listened to many people who talk about the conspiracy aspect of it, and you know, it's so easy to talk about a conspiracy, but to prove a conspiracy is a different thing. Now, listening to Alec Jones and my friend George Norrie and his lineup of guests who say the government is up to no good, the government is using this as a ploy, blah, 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 blah. I don't buy that.
Right.
I really don't buy that. I believe that there is another explanation. But just because you don't understand something, throw it into the conspiracy aspect of life, because that way there, you don't have to prove anything.
I agree with you, but I wonder, what have you come up with?
I'm sorry?
I'm wondering what you have come up with. I mean, you don't have to call it a conspiracy, and I'm not. Don't misunderstand me. What I am saying is I worry about things like this. When I see there's no epidemic, I see it's not a lethal virus. I know the vaccine may not work. It hasn't been proven. I know that the people making the vaccine are immune to it. I mean, it could be a ploy, another way to look at it, to make $10 or $20 billion for the vaccine makers. That would make sense. And, in fact, the government's already purchased it from them. But why then would the government, if they've purchased it from them, insist that everybody take it? Mm-hmm. Particularly when they know it may not work, and the epidemic is on the way down, and that our natural immunity is going up, and that's the best way to get immunity to it. How do you put it together?
They're very good points, but how could this be perpetrated, and how could the CDC, as well as other government agencies, get behind this inoculation if it was not real? Now, surely, to goodness, other members of the medical profession would be whistleblowing their heads off at this time if there wasn't something to worry about.
Would there?
Why not?
I'm not convinced of that. I think that a lot of the time, you know, it took me a long time of practicing medicine to question immunizations in general. Because when you look at immunizations, you're thinking, gee, these are the bastions of medicine. I mean, this is what preventive medicine is supposed to be about. Immunizations are a huge part of people staying well. And then when you start reading the literature on it, you're looking for the double-blinded, placebo-controlled crossover studies. They're not there. Yeah. So what happens is we've got this idea that they're good, but we don't have any proof to back it up that's really solid. It's not good, solid scientific data. Take a look at the stuff from Gary Null that's out there, and here's a guy that's really solid. Go to his website sometime, GaryNull.com, and look at what he has to say about immunizations. Look at the videos that he's produced that are just rock solid, that say we've got a problem here.
We've got a problem. You know what? Part of the problem, I believe, Doctor, is that so much disinformation is being put out on the internet. Anyone with a cheap camera can make a video, throw it up on YouTube, and society still believes whatever they see on YouTube has to be real.
Yeah, well, that's a mistake.
Well, sure.
And there's a lot of danger in looking at anybody on the internet, because you're going to see a lot of nuts out there. Mm-hmm. But when you see people like Gary Null and myself, I have a video up there myself that talks about this, and I've studied it, and I've been in internal medicine for 40 years now. This isn't something you come to lightly. I mean, there are a lot of people out there saying things that they can't prove, and I can't prove this either. Right. But then we've got a problem here. It doesn't add up. Somebody's got to be wrong. It doesn't make sense.
And if it doesn't make sense, there's a problem.
Yeah. I mean, we're putting out a vaccine. We're scaring everybody, telling them there's a shortage. We're reimbursing the vaccine makers. Mm-hmm. We're telling them that if they do something that is that hurts people, that they're going to be immune to it. They don't have to worry about any lawsuits. I mean, there's something wrong with that picture. I mean, if you don't need the vaccine, why are we taking it?
Exactly. And the fact that, as you were saying, there are so many questions being asked about this, and the answers are not forthcoming,
Right.
just points to the direction that there is something someone knows that the public, as well as the majority of the medical community, are not being made aware of.
That's
And
right.
that bothers me. That troubles me. My wife is a nurse. She deals with this, 24/7.
Sure.
I worry about her. I worry about the friends that I know in law enforcement that are other friends that are first responders, other friends within the medical community. I worry about my kids. And I listen to the different people who've been on the show, and everyone, for some reason or another, is an expert when it comes to the H1N1. You, sir,
Yeah, sure.
have the qualifications and the credentials to be an expert, and I wasn't including you in that little statement. So if it came out that way, I apologize. Your credentials, sir, are impeccable.
I think that were great questions, and I appreciate them, Rob, because it just shows that you're not BSing around. You know, you want to hear the truth, and
Exactly.
if your guest can't stand up to the heat, doesn't belong in the kitchen.
You know, I had a veterinarian on a couple of weeks ago who claims to be an expert on H1N1.
Mm-hmm.
And excuse me, what does being a veterinarian have to do with knowing what is going on with people? Now,
Yeah.
you know, and then I've had other members of the conspiracy side of life. I've heard everything from that the vaccine is being used to prepare us for alien intervention to
Yeah, sure.
to it's a way of that, you know, somebody else said that there might be nanobots within the vaccine, and that what is happening is that we are getting these little trace elements being put into us so the government can track us and track our every move.
Mm-hmm.
Well, if this was the case, the government wouldn't have to create such a pandemic in order to do it. Plus, if it was the case, I could understand it being just within the confines of the United States and Canada. However, this is worldwide.
Mm-hmm.
So what is the global cause? What is the global agenda?
Yeah, see, we don't know.
Yeah.
So that's when you use your imagination. You listen to people. You try and be scientific about it, which means you listen to what people have to say. You use your good judgment, and then try and test the hypothesis.
Right.
And that's not always so easy to do because we don't have any transparency here. People are holding information back. The government's lying to us. And if this thing, if it didn't affect us so deeply, if it wasn't the Patriot Act that was involved here, which could impose martial law on us and force us to do it, and then the White House tell us, don't worry about it, we didn't mean that, we're just trying to do some little things to make hospitals and doctors be able to work more efficiently. I mean, hello?
Yeah.
I mean, I'm buying that is that simply. Now, I don't know what's going on either. But something's going on that doesn't make any sense because this doesn't make sense.
Doctor, stand by. You and I have to go to the news break. What is your website, sir?
It's a returntohealing.com. I have a book out called A Return to Healing, and it talks about the problems in healthcare
Doctor,
and what's gone wrong.
Dr. Saputo, please stand by. You and I are going to take a 2-minute commercial break. Exo Nation, our very special guest is Dr. Saputo, and we're going to be back talking about the H1N1. And I'm going to ask the doctor point blank, what is wrong with our medical system? I'm in Canada. I cannot understand the problems that my friends in America are having with their health care plan. Here it's very simple. You're sick, you go to the hospital, you give them your Medicare card, and away you go. It's that simple. My name's Rob McConnell. This is the X Zone, a place where people dare to believe and dare to be heard Monday through Friday from 10 p.m. Eastern until 2 a.m. Eastern. Then the show is repeated in its entirety from 2 until 6. I'll be back on the other side of this commercial break with Dr. Saputo as we continue live and around the world on the Talk Star Radio Network from our studios in beautiful Hamilton, Ontario, Canada. Don't go away. We'll be back right after the news.
The X Zone radio and TV show is largely an opinion talk show. All opinions, comments, or statements of fact expressed by Rob McConnell's guests are strictly their own and are not to be construed as those of the X Zone radio and TV show or in any manner endorsed by Rob McConnell, Relmar McConnell Media Company, Talkstar Radio Network, its affiliated stations, or employees.
Hi, this is Eric Rawls of Cosmoverse.com, and you're listening to Rob McConnell in the X Zone.
Hi, this is Blade Runner, and you are listening to Canada's #1 paranormal radio show, The X Zone, with Rob McConnell.
Hi, I'm Laura Sabrin of Feast to Fields Organic Vineyard in Jordan, and you're listening to Canada's #1 paranormal radio show, The X Zone, with Rob McConnell.
Hi, my name is Lady Ashley, the White Witch of Niagara-on-the-Lake, and you're listening to Canada's #1 paranormal talk radio show, The X Zone, with Rob McConnell.
Welcome to the X Zone, a place where fact is fiction and fiction is reality. Now, here's your host, Rob McConnell.
Come stop your crying, it will be alright. Just take my hand, hold it tight. I will protect you from all around you. I will be here, don't you cry. For I'm so small, you seem so strong. My arms will hold you, keep you safe and warm. This bond between us can't be broken. I will be here, don't you cry. 'Cause you will be in my heart. Yes, you will be in my heart. From this day on, now and forevermore.
Welcome back to the X Zone, everyone. My name is Rob McConnell, and you're listening to us live and around the world on the Talkstar Radio Network from our studio in Hamilton, Ontario, Canada. 1-877-528-8255 is toll-free. And I'd like to say hello to all our affiliates across Canada, the United States, Central America, South America, the Pacific Rim, the Caribbean, 24 Asian countries, and across Europe. My guest this hour is Dr. Saputo, and we are talking about the swine flu, H1N1, or maybe it should be called HOAX1. I'm not sure about that. But the good doctor and I are having a good time discussing it, and everyone is talking about it. But if you want to get to what I consider to be the bottom of the barrel of this question, here's a website, www.areturntohealing.com. That's www.areturntohealing.com. And Dr. Saputo is also the author of A Return to Healing, Radical Health, Care, Reform, and the Future of Medicine. Before we go any further, Doctor, why is there such a problem in the United States with this health care bill? To me, being a Canadian, it's not that complicated.
That's because you guys have done the right thing. I mean, you've got the government to run the program because you ran into the same problems we did,
Yep.
and that's that there's too much business and not enough service. And so we're interested in money, and that's what we're doing. I mean, the U.S. knows how to spend money, right? We spent $2.3 trillion a year on health care.
Wow.
Comes to $7,000 per person and 18% of the gross national product. And we're ranked 37th in the world. We're certainly behind Canada. When you rank all the industrialized countries in the world, the last survey I saw was Canada was 10th. And out of 16 countries, we were 16th. We're doing something wrong. We can spend the money, but we can't find a way to provide the service because it's about business. It's about making...
As a medical practitioner in the United States, do you think that President Obama has bitten off more than he can chew?
I don't know. I voted for him, and I'm still in his corner, despite some of the things I've said. It's a big job to try and reform the corruption that's in Congress. See, America has become a corporate democracy.
Yes.
It's no longer an individual democracy. And so the money that is going from corporations into Congress has corrupted them to the point where they represent where the money comes from because they're always worried about their next election and they need to raise funds. Then they come home to us crying and they have these town hall reforms and people are throwing cabbages and eggs at them and they wonder why. It's because they lie to us. They tell us that they're going to do the right thing. Then they get to Washington, D.C., and they do the wrong thing. They take the money. And then they're beholding to Big Pharma and they're beholding to the insurance industry. The insurance industry spends over $1 million a day lobbying with Congress. Why do all the Democrats and all the Republicans polarize against one another? If everybody's thinking the same thing, Benjamin Franklin says nobody's thinking. What you've got is a political system here that hangs together. And it's not about logic. It's not about nonpartisanship. It's about trying to protect those investments so the money will keep pouring in, and we, the people, are not getting what we want. So the consequence is we're getting insurance reform, some economic reform. There will be more people covered by health care insurance by the time this thing is done. We've got 47 million working Americans that don't have insurance.
Yes.
That's a tragedy. They can't afford it. They can't qualify for Medicaid, which is for the poor people, and they can't afford to buy regular insurance. The insurance companies are corrupt because what they'll do is do anything to make a buck. They're responsible to their stockholders and not responsible to us. So the consequence is what you see. They cherry pick the people they want to accept into the insurance program because they don't want to spend money coming back. If you get sick during the time that your term for insurance runs, which is year to year in some places, they won't take you back. They put caps on how much will be spent. What kind of a system is that? Who's it designed for? It's not designed for people. It's designed to make money. So America's corporate greed is what has led to a healthcare system that's inadequate but spends tons of money. It's an economic stimulus package. It's not a healthcare system. We need to be listening to the other industrialized countries in this world that have made some sense out of it. And you guys in Canada have done a good job, but you've paid your price too. Because when you started out, it was all that way.
Yeah.
And there were long lines and things weren't good, but you learned your lesson. You went ahead and you opened it up so people could have the government insurance and also have private insurance on top of it, which is fair enough.
You know, I believe that the insurance companies are going to be losing a ton of money with the proposed healthcare plan. And if anybody has the wrench to throw into the gears, it's the private insurance companies.
Mm-hmm. Well, I think the private insurance companies are going to do well with this.
Really?
Because I do think so. Because what you're going to see, yes, a few restrictions, but you're going to see an insurance policy. It'll probably be something related to a public option, which means that for people that don't know what that is that there'll be an arm of the government that offers health care insurance for whoever wants to take it. But it's going to be such a bad insurance. It's going to be like Medi-Cal or Medicaid. The guts of the program is going to be taken out. So you may have some insurance, but let's face it, people in America have insurance today. They just go to the emergency room when they're sick. The follow-up's no good. They can't get the drugs that they need when the drugs are indicated. And, of course, we overuse drugs, something awful, because Big Pharma is another culprit in this thing.
Oh, jeez. Tell me about it.
Yeah, it's a mess. I mean, we go to Canada now to get our drugs. And we're going, I mean, we should be, Mexico should build a fence to keep Americans out of Mexico because we're going to Mexico to buy drugs. It's a joke.
Yeah, well, I think that the leaders need to sit back and take a good look at what's going on. You know, for example, I know that the medical people, the medical field in the United States, as well as here in Canada, is underfunded, understaffed.
Yeah.
You know, where you should be putting your extra money, instead of bailing out car industries that need to go by the wayside anyway, put the money where it will serve the people the best. Whatever happened to we the people? It seems now it's I the person or I the corporation.
Right.
So tell me, Doctor, how do we return to healing? What is the best way to do this and the most effective way?
It's really easy. It's really easy. First of all, we have to evolve to a higher level where we want to provide service rather than the narcissistic approach to having stuff and money. Mm-hmm. That's number one. Number two, it's really simple. You go from a system that expects you to get sick and then applies all this incredible technology that makes, I mean, let's face it, medicine in America at its best is fantastic. You can't get any better than that. But it's aggressive. It kills too many people. It costs too much. And what we need to do is have people take care of themselves. Do the lifestyle things. Eat a good diet. Exercise. Reduce your stress. Get 8 hours a night of sleep. Keep your weight down and have a meaningful purpose in your life. you're going to cut healthcare costs by about 75%. We need not only a shift in the system that brings healthcare to everybody, because it's a right, everybody deserves healthcare, but it needs to be shifted to a system where there's prevention and wellness and nutrition and natural therapies, and we take responsibility for ourselves. We can't believe all this hooey of these direct-to-consumer ads, which you up there in Canada are smart enough not to allow, but we spend $5 billion a year on to confuse people and tell them things that aren't true. I mean, we've got to do that. We do those things, we'll be all right.
But you know what? Not enough people will be making money and getting kickbacks. And I know, and other people in the industry, and John Q. Public knows the truth.
Yes.
It's all about money. Nobody gives a damn about their health.
That's right.
They just
But
want
the
to make
Americans
money.
have fallen asleep at the wheel. Our democracy's gone. It's a corporate democracy. And now we're on our own.
But you know what?
And nobody's representing us.
It's never too late to turn around and make things work. And it's
Right.
people like you, talking the way you are, writing the book that you did, having your website that allows John Q. Public to get an awakening call, that's making a difference. And my hat is off to you, sir.
Thank you. Well, we can do this. I am totally inspired. I know darn well we did it in 1776. We can do it today. We did it once. Our forefathers gave up huge sacrifices for us, and we've blown it because we've become too capitalized, too commercialized, too much interested in money and things, and not interested in the things in life that matter, which is about giving and sharing and caring and having and living in a community where there's love and support. It's about giving as much as you can and receiving graciously, but not taking things from people. We can go back and do that at the grassroots level. And if we don't do it, we're in big trouble.
But society today, sir, is very lazy. If we can't drive through the drive-through to get our coffee, on our way to getting our Egg McMuffin, on our way to work, while we're shaving, putting makeup on, and playing with the laptop and the iPod and this and that and the other thing, all sitting on our butkus.
That's right.
You know, nothing will change. I agree with you. The first thing...
it's a grassroots-driven requirement.
Yes.
We have to go back to the grassroots. We've got to start doing programs in nutrition and exercise and stress reduction and meaningful purpose in life and knowing why the hell we're on this planet. What are we trying to achieve?
We're trying.
Too much of us, we're up at 6, home at 6, we eat dinner, we watch TV, we go to bed, we do that 6 days a week or 7 days a week, and we wonder why suicides and addiction to alcohol and drugs and our kids are in trouble. We wonder why that's a problem. It's like, hello, time to wake up.
Sure, take a look at the size of people these days. My God, I was in Walmart before with my wife, and I thought I was in the middle of a feeding frenzy at the local farm.
Yeah, well, what's left besides eating?
There's
Our
a
rights
lot.
are gone.
Gosh, get out there. Get involved in sports. Get involved in your children. Get involved in being a family member again. Sit down and have supper together and have something that is good for you, not the crap that's filled with aspartame, this,
That's right.
this, that, and the other thing. Get back to basics. Like you're saying, Doctor, grassroots.
Get back into life. Live it.
Hallelujah.
Know what you're living it for. Don't just cruise through it. You know, our schools, the education's a tragedy. We learn reading, writing, and arithmetic, and we forget why we're here. We forget about how to get along with people. What's the purpose of life? I mean, what are we doing here? These are the things we need to address.
What we're doing here is very simple. We're taking up time and space until we go. That's basically it.
That's right.
And that's a shame. That's a shame. Go out, walk. People say, well, I'm looking for the wonders of life. Well, open your eyes. They're all around you. A child smiles. A child laughs. You make somebody happy. Go over and shake the hand of a veteran who fought for you in World War I, World War II. Get out there. Be with people. Make the difference. Because if you're going to sit at home and just keep on woofing those Mars bars down while you sip a Diet Coke with aspartame in the other one hand and a bottle of beer in the other, man, you deserve to die. You're taking up valuable space and money.
That's right. Take your Prozac. Take your Valium. Take all those pills that are going to make you feel better and don't do a damn thing about what the problem is. It's time to wake up.
The world
needs to wake up.
You know, you and I can get into a lot of trouble together. I love it.
I think we just did it.
Doctor, please stand by. You and I have to take our final break for this hour. Exo Nation, www. www.areturntohealing.com. www.areturntohealing.com. That's the website. My guest this hour is Dr. Saputo. And visit his website. I agree with what this gentleman has said over the last 40 minutes. And for me to agree with someone as much as I have with Dr. Saputo, he's on the right track. We can make a difference. We, the people, it's not I, the person. We, the people, no matter if you're living in the United States, if you're in Canada, if you're listening to us in Britain on the BBC or anywhere else, people who band together can make changes. And the power is in each and every one of you. Dr. Saputo's website, once again, is www.areturntohealing.com. That's www.areturntohealing.com. And the good doctor and I will be back on the other side of this commercial break as the X Zone continues on the Talk Star Radio Network from our studios in Hamilton, Ontario, Canada. If you'd like to send me an email, xzone@talkstarradio.com, on MSN Messenger, talkstarradio@hotmail.com. And our phone number here at our studios in Hamilton, Ontario, toll-free, 1-800-610-7035. X Zone Nation, I'll be back on the other side of this commercial break with Dr. Saputo, right here on Talkstar.
Come stop your crying, it will be alright.
Dr. Saputo's our special guest of this hour, X Zone Nation. www.areturntohealing.com. www.areturntohealing.com. First of all, Doctor, thank you very much for joining us tonight. And if we were to encapsulate what people can do in 2 minutes, what would you like to say to the X Zone Nation?
Remember Gandhi?
Yes.
Be the change you want to see. That's what you can do, and take action on that. Don't worry about what everybody else is doing.
Be you.
You find a way to take care of yourself.
That's right.
And do it the way that you live in community with people. Live a life of service. Be connected.
That's powerful.
Gandhi did pretty well for himself.
He did. He and the great people of this planet, present and past, have always been those to talk about the power of the person, the power of the individual. And I think that throughout the years, the population has been suppressed or battered into believing that an individual cannot make a change. Well, that's one of the biggest lies going, because it takes one person with an idea and the conviction to follow that idea that will gather people behind them, and they will make that change.
Without a single idea, you never have a change. And so it's something you have to really respect. And then you have to walk the talk of it.
That's right.
And it can be done at the grassroots level, and you can build like an amoeba. You know, we're doing a little project in Walnut Creek, little town in California with 50,000 people, and we're out there changing what people eat in our city. A little housewife got the idea that it would be a good idea to have some rules for what you ate, and so I put together a board of 25 experts from across the country, and we came up with 3 things: no high fructose corn syrup, no trans fat, and make sure there's enough fiber. And that little girl and our committee convinced 19 mayors of our county to take the pledge, the Walnut Creek Wellness City Challenge pledge, that they would not serve anything that didn't meet those standards in their meals or in their vending machines. That's the start of grassroots power. One little housewife, I got to do it because it's right. Next, we go to Healthy Restaurant Association. Then we go to the PTA at the state level, because that's what you have to do in our state. And then you go to the hospitals and see if you get a decent meal in the hospital for a change.
Yeah, that's always baffled me. Why is hospital food so lousy? You're there to get better.
We're into disease care, and we're into drugs and surgeries, and we don't think about the basics. The word nutrition and the word detoxification don't exist in medical training. You get about 1 hour of nutrition and no detoxification the whole time you're there. It's like insanity.
Doctor, we've run out of time for tonight, but I do want to thank you so much, and I'd love to have you back on in the future because we still have so much more to stir up between the two of us.
Oh, yeah, there's a whole paradigm in this book that we never got to that talks about what's health medicine, what are the pillars of it, how do you practice it, how do you do group practice.
Why don't we do this?
We'll get to it.
I'm going to get a hold of Eileen, see if we can arrange something for next week or the week after. You and I have to do this, and thank you very much for being there and for shaking the apple tree with me.
My pleasure. Privilege to be on your show.
Good night, Doctor. Take care of yourself. Exo Nation, www.areturntohealing.com. That's www.areturntohealing.com. My guest this hour has been Dr. Saputo, and we'll be back on the other side of this commercial break as we continue live and around the world on the Talkstar Radio Network from our studios in beautiful Hamilton, Ontario, Canada. Don't go away.